to kind of give a little introduction. So I did my medical school in India, and I did my residency and fellowship training from Philadelphia in geriatrics. So geriatrics is basically specializing in caring for seniors, people over the age of 65. But the way it is now, it's really working with the oldest old. So I would say my oldest patient has been 106 years old. And a palliative care, I don't know if you're familiar with what palliative care is. It's a relatively newer specialty, and it's a specialization in caring for people with advanced illness. And it involves really focusing on symptom control and talking about goals of care. So it's really an evolving specialty, and it's been actually quite a privilege to be able to get board certified and work with patients on that. So I didn't really have a format in mind. I do know that we are in the middle of COVID right now, and I don't know if you've had other sessions on that, are at high risk with COVID, and also with the fall season coming up, which is typically the flu season. I wanted to make a special kind of recommendation and push for people to take their flu shots this year. I think most places are going to start giving them out early. I know Palo Alto Medical Foundation, where I work, is going to be giving them out end of September, but I know CVS, Walgreens, Kaiser, all of them are giving out flu shots already. So I just wanted to put in a quick reminder for folks to make sure to take their flu shots this year, as it's going to be especially important to fight the flu and the COVID pandemic. So I didn't really have any prepared statements, but if people had questions, I'd be happy to take that.
Yeah, so there is already one question for you. It says, what do you think about taking vitamin D3 every day?
Yes, I think that's a great question. So I would say that, typically, especially South Asian and folks tend to be a little bit vitamin deficient. And if you're not eating meat, that also helps. Though the milk is vitamin D is present in that, but I would say it's definitely a good idea to take basic level 800 units of vitamin D every day with some calcium. If you're taking calcium in milk and yogurt, that's good. Vitamin D is very, very vital for bone health, so it's definitely a good thing to consider. If you have a primary care doctor or you're a regular physician, you can also get a vitamin D level checked. And some people, if they're deficient, they may need a higher dose of vitamin D to replace. And once that replacement is done, a baseline dose of 800 units to 1,000 units is what's recommended. So it's a good idea for sure.
The other question is related to the pain. Somebody said how to handle the pain during these times. So going to the hospitals is hard, or, so what might be the best way to approach the physicians or the personal care?
Yeah, that is actually a very good question, because I think when the pandemic first started, going into the doctor's office was also getting challenging. A lot of doctors' offices now are offering teleservices, so through FaceTime or telemedicine services. So you can definitely approach your doctor's office to find out if they are now offering, online services. I would say if you're talking about physical pain, the first thing to do is to start with your primary care doctor or the doctor you see regularly for pain management. It depends on what kind of medications you're on. If you're on over-the-counter medications or you're taking specialized medications, the doctor might want to connect with you again and just, go over your current status. But I would say start with your doctor. If you can go in, I saw a question just popped up, if it's okay to go in to the office. And I would say that, compared to when the pandemic first started in March to where we are now in September, most offices have really establish processes to make patients safe. Staff has been educated. Everybody has to wear masks, and they have made their surroundings pretty safe. So I would say it was safe to go into your doctor's office, but call them first and make sure you wear a mask when you go, and make sure that the nursing staff and others are wearing masks, which I would think in a doctor's office would be standard procedure. But also, if you feel like you don't want to go in, definitely ask about teleservices. And most doctors' offices are providing services through the internet, and that could be a first step.
Thank you. So the next question will be with your specialty, like the two specialty. One is the geriatrics, and the second is palliative care. So uh, how people can differentiate, like what kind of care they should seek for, especially
Right.
regarding the palliative care. There is less information available, or people know, or they're recommended also to go and seek palliative care,
Yep.
but there is not much resources or information on where they should start.
Right. I think that's a great question. So I would say, geriatrics is a relatively older specialty compared to palliative care. One thing that's common for both specialties is there are not enough physicians trained in both. So it is still a rare, specialty. You don't see them very easily available services. I would say the first place to start would be with your primary care doctor. Um, Geriatrician, so the way I describe it is geriatricians help with kind of um, more of the problems associated with elderly, frail seniors. So if somebody's having, falling way more often, or if they're having issues around health, mental health issues, if they just want an additional opinion about, am I doing everything right in terms of my aging and aging in a healthy manner? Um, then I would think a geriatrician is really helpful, to get a consultation and kind of review those questions. Palliative care goes in a little bit different direction. So let's say somebody has a diagnosis of cancer and they are having pain that is not being typically controlled, then I would think of palliative care. Or if somebody's really having symptoms like pain or shortness of breath that are not very easily controlled, then palliative care can be helpful. And often the primary care doctors still need to be prompted about it. So if you ask about palliative care, they will know where to send you. Um, I think most bigger organizations like Palo Alto Medical Foundation, Sutter, Kaiser, they all have outpatient palliative care programs. So it's becoming pretty much the norm. Stanford, they have outpatient palliative care programs. I know El Camino Hospital, most hospitals have programs as well. So that would be the place to start, to ask for that referral.
So will you also highlight a little bit about the insurance options and how people can sort out the financial aspect of these cares?
Sure. So a geriatrician and a palliative care physician is basically essentially physician services. So if you have Medicare or Medicare Advantage plans, the consultation would be covered, just like any other physician or any other specialist services are covered. And there haven't usually been any kind of pushback from insurance companies about getting services of a geriatrician or palliative care physician paid for. Um, Now, often we will refer additional referrals like home health agencies who come in and provide physical therapy, occupational therapy, speech therapy, and those services are also covered by Medicare. So there hasn't really been an issue in terms of extra costs to the patient um, for seeking out geriatrician services or palliative care physician services. It would be pretty much like how other specialty care like cardiology or endocrine is paid for.
Okay. So now the other common things people encounter is like dementia or
Mm-hmm.
Alzheimer's during this time. So what will be the best approach? Because sometimes is the palliative care as an option for the similar conditions, or the
Yeah.
geriatrics, how to define those, when to interchange? And
Okay. I think that's a great question. So I would say this, let's say somebody was in the early phases of memory issues. So often it's like a journey. Somebody, as we get older, we all have memory issues. Sometimes we have difficulty with names. Sometimes we forget where we've kept stuff. So some parts of that are what's called normal aging. And the physician has to kind of help, patients figure out what's normal aging and what's going into the diagnosis of like memory loss or dementia. So the early parts of the journey of dementia and the middle part of the journey of dementia, a geriatrician is much more helpful in the diagnosis, in the treatment, in helping guide around medications, in helping figure out what kind of supportive services are needed. That is more a geriatrician. And I would say towards the later part of dementia, because dementia is also a kind of an illness like Parkinson's disease and other illnesses, which is more of a degenerative disease. So palliative care is more helpful towards the later part of the disease when somebody's sicker, having more behavioral issues and other things that need more support. So I don't know, it's still a little vague, I think, but how I would describe it. And again, it's hard to know from a patient's perspective what's the right time, but I think just discussing with your primary care doctor is a good first step to figure out. And there are some things that both a geriatrician can do and a palliative care physician can do. That's why you'll find often that it's people who work with seniors also get trained in palliative care. So it's not a very clear-cut demarcation, but if there's more symptom-related issues, pain, behavioral issues, then I would say palliative care makes more sense. And if it's more around function, what's the right place for me? Should I go into an assisted living facility? Should I think of an independent living facility? Should I think of a nursing home? Those kind of questions, a geriatrician is more likely to be the right person to go to. For both of them, though, I want to put in a special plug for thinking about advanced directives and goals of care discussions. Especially if somebody's creating a trust, for example. I think the lawyers will often ask people to create an advance directive. And that is something that we typically, I think, want to put off, but it's really important to designate somebody as a power of attorney for health and to think through some of our decisions that we have to make in terms of, would I want to be on a breathing machine? Would I want resuscitation? Those kind of questions. And both a geriatrician and a palliative care physician can help with those questions as well.
thank you. So there is another question by Tina. So she wants to know, do you have any special recommendation for the glucose monitor machine? And second thing is, how reliable are they? And do you prefer the machines or the going to the laboratories more trustworthy?
Yeah. So there's two kinds. So doctors actually require two kinds of blood results for blood sugar. One is the finger stick that you can do at home with, sticking with the little needle and checking with the glucometer. And there's several different kinds. I don't particularly have a specific brand in mind, but most of them that are available in the pharmacy do a good job. So that's one that is, what a patient can do themselves also, and you can do it at home. And then the other test that doctors usually want is what's called hemoglobin A1C. That is a test that's done about every 3 to 6 months. And that gives more of a picture of what your blood sugar has been like for the last 3 months. And that test is a more specialized test and needs to be done in the laboratory as a blood test, blood draw. And so I would think that, again, it's hard to give specific advice, but if somebody has diabetes, they should definitely get the lab blood test in the laboratory done at least twice a year with the hemoglobin A1C. And then if based on your doctor's advice, you might want to check it at home as well on your finger stick. So both are useful and both give you a little different information.
Okay. So one more question will be, as a geriatrician, can you offer us like 3 or 4 tips, takeaway points home in lifestyle and maybe in the diet also, because that's also very important part. And
Yes.
current days it's hard to get a lot of options, and they used to be your shopping is limited. So how to get the balance, nutrition, and also something about the activity, uh, because of now the smoke is outside, we can't walk.
Yeah.
Yeah.
Yes. Actually, that's an excellent question, because I think the more we can do to, in terms of our lifestyle, to age in a healthy manner, the better off all of us are going to be in terms of preventing frailty, preventing dementia, keeping engaged. So when times were normal, that is before COVID, before the fires, the advice I always give is the three most important things. And this is very, very common sense, but exercise, physical activity, being physically active, nutrition. And the third thing I say is social engagement. I think as we get older, it sometimes does become more challenging to intermingle with other people. Um, but, being socially active and socially intermingling is really helpful in terms of preserving our memory and cognition and our mood. Um, Now, in the era of COVID, I think, and the fires, it's definitely become a little more challenging. Um, the fourth thing I would say is also kind of intellectual stimulation. Whether it's a hobby that we have, that we pursue, whether it's listening to music, whether it's doing puzzles, whether it's some kind of work that we stay intellectually engaged, much better than just sitting and watching TV or a screen. In terms of physical activity, I think walking is the best and safest thing. And even if you can go outside with a mask in a safe environment, that's great. If not, even walking within the house. If people are not able to walk, even doing upper body exercises, anything that gets your heart rate up a little bit and moves your muscles is a good thing. um, Nutrition, I would say, again, protein is helpful. Now, again, I don't know people's specific health conditions, but definitely you want to get a certain amount of protein, fruits and vegetables, a multivitamin tablet. And I think the hardest challenge that has become in COVID is the socialization, because it's all about social distancing. I feel like it's impacting the seniors a little too much in a negative way. And I'm so glad that you have this, online forum as a way to connect, for people to connect with each other. I think we're going to have to be innovative in how we get people to connect with each other, especially seniors. But it is very, very key and very, very protective for memory. So that's kind of my long-winded but shorter answer. But I would say, continuing to find ways to stay physically active and socially connected is going to be very important.
Yeah, we are very fortunate that way, because through our Indian Community Center, we have a couple of seniors group, and they meet every day from 9:30 till noon, and a lot of cultural interaction happens. And that's why we initially labeled it as a support group, and then we eventually started calling it Happy Seniors, Happy Monday program, because everybody's it's like quite happy and cheerful and socially engaged, because they spend good
Yeah,
amount of time together, with a lot
yeah,
of intellectual stimulation, discussions, music programs, and talks, and variety of things.
that's
So,
yeah, that's
yeah.
excellent.
So the next question will be, uh, what kind of resources do you recommend, like in Bay Area, people can access for both specialties, like the geriatrics and then also for the palliative care? And the third question will be, I know you have the background also into the alternative medicine, a little bit an interest. So how that will also translate for both specialties.
Wow. Okay. I'll try to answer all of that. Um, so, this is what I would say, that, both geriatrics and palliative care is kind of an interdisciplinary specialty. So if we see as we get older, you know, I think when we are, let's say, in our 50s and 60s, most of our health problems are like diagnosis based, diabetes, high blood pressure, heart disease, maybe some lung disease. But as we get older, it becomes of a more, not just a diagnosis or a disease based problems, but it involves kind of other disciplines. So it could be dietary issues, it could be physical issues, it could be cognitive issues. And so typically both these disciplines, to do a good job, need to work with other disciplines as a team. And that includes a dietitian, a physical therapist, an occupational therapist, a social worker, a speech therapist. And all these disciplines are available in the community, and their care is paid for through insurance and Medicare. I would say Medicare as an example, their care is paid for through insurance. So um, it's really, so for example, if I were to see a patient, for example, that was referred to me, I'm going to go through a set of questions as a geriatrician that tries to find out how is the nutrition of a person. Are there difficulties with swallowing? Are there difficulties with chewing? Are they having falls? What's the muscle strength like? And then I will make referrals to the appropriate discipline, whether it's dietitian, whether it's physical therapy, occupational therapy. And all of these are available in the community. But I would say that they need that physician guidance to figure out who is the right discipline to get involved with at what time. And then work together with the physician and come up with the proper solution. And that's true for geriatrics and palliative care as well. Palliative care, there is one more other resource that's in the community. And most people are a little bit, I think, worried and scared about talking about this, but that's the hospice services,
Yes.
which is, something that is provided by Medicare and comes into play, or physicians will refer to hospice if they feel like somebody has a limited lifespan, usually about 6 months to live. And the focus of hospice is really to keep that patient in their home environment and keep them comfortable. Sometimes it can be a little scary because nobody wants to think of end of life. But I think they provide a wonderful service, and there are lots of agencies in the community that we work with closely. And I've known personally a lot of my family members and friends whose parents and other family members have benefited from hospice services. And I'll be happy to answer more questions later on also if people have
Yes.
questions about these specific services. And what was the third part? Oh, alternative medicine. So, I think that's something I want to learn more about. But I do see a role for Ayurvedic, homeopathic services in seniors, especially the way I think about it when there is chronic pain involved. We don't have very good answers in allopathic medicine. And there's definitely, based on the right diagnosis, I wouldn't suggest anybody just go and do that, on their own. But there is massage therapy can be helpful, ultrasound can be helpful, physical therapy has some solutions to that can be really helpful. So I rely on other practitioners who are experts in their field on that. But I think the really interesting part of my job is to be able to work as a team with these other practitioners and try to help our patient together. So that's how I would, so it's really a team-based approach if done the right way.
Thank you. So there are two more questions from the audience. So one is from Malvinder Kaur. She said, if I take blood pressure at home and then take 2 or 3 readings consecutively, they appear to be different. So which one should I accept to document?
Okay.
That's a tricky question.
That's a tricky question. So instead of answering the question specifically, here's what I would say. If you have a blood pressure machine at home, you want to kind of take it into your doctor's office once or somewhere else where the doctor is checking your machine and get an idea, calibrate your machine. get an idea that if the doctor's office is showing, certain number and your home machine is showing a certain other number, what's the difference usually? If it's a difference of 5 points at home, let's say you take 3 readings at home and it's a difference of 5 points, that is kind of okay. It's a norm of, variability, because our blood pressure is not the same every minute of every day. There is variations. If you're physically more active, your blood pressure could be higher. um, so get it calibrated would be my first piece of advice. Second is always have kind of a routine when you're checking your blood pressure. So let's say you want to do it in the morning, make sure you're sitting down for about 5 or 10 minutes. You're not like working in the kitchen and doing things and then come and check your blood pressure. No, sit down, give your system about 5 or 10 minutes to calm down. Make sure that your legs are not crossed, make sure you're not stressed, and then check your blood pressure. So that's more likely to be kind of your blood pressure at that time. And if you've done that, then I would accept that number. The other thing I would say is kind of make a notation, keep a chart of your numbers and see if there's a pattern of blood pressure. If like every day morning at 9 o'clock, your blood pressure runs a certain way, 12 o'clock, your blood pressure runs a certain way. Just try to understand your pattern. But if consistently, let's say 3 readings of yours are all above 140, the upper number is above 140, then that is more important than whether it's 138 or 142. That is, those little variations are less important. It's really whether it's above 140 or below 140. That is, I think that's how a doctor would look at it. So keep a record of your numbers, share it with your doctor, and try to have a routine way of how you check your blood pressure, and get your machine calibrated. You could even get it calibrated at a pharmacy. They may also help out with that.
Thank you. So there are two questions. I will bring them together. One is from Yasmin and one is from Tina. So the Yasmin's question is, it's already 6 months we are wearing the mask. So how long it will continue in your opinion? And then should we accept it as a new caution? She said.
Yeah, that's an excellent question. I personally think that going into the fall, in September, October, November, December, is really, we still need to be very vigilant and need to be very careful and continuing to wear the mask, because it's going to be the winter months and we have additional flu to deal with. So I would say continue precautions, continue to be vigilant, continue to wear a mask. If you think about it as an intervention, a mask is pretty simple solution to prevention. Some people may truly have some breathing trouble with the mask, but most people seem to tolerate it okay. It could become the new fashion accessory, match it with your clothes, match it with your outfit. Make sure you cover your nose, because that's very important. Cover your nose and your mouth. But yes, I would definitely encourage to wear a mask. When and if we get the vaccine for COVID and it's well tested and it's well accepted, and we are able to really reduce the numbers in the community, then we may be able to do away for the mask. But for now, I would say at least for 2020, maybe even early 2021, mask is going to become pretty essential. It's the new fashion accessory.
Okay, thank you. Then the other question is same with air quality, saying just if the windows are closed, is that adequate, or the air purifier is recommended? And I will add one more to it, saying what you think of the ionizing purifiers, which are supposed to controversial for the benefit versus the.
Yeah. I don't have a lot of information on the ionizing purifiers, but I would say this. I think people who have underlying lung conditions like asthma, COPD, um, emphysema, they need to be a little bit more cautious and probably consider being a little bit more careful with the air purifier route. Most other people are okay as long as you're monitoring the air quality indexes, and going out when the numbers are low should be pretty safe. um, but those people who definitely have some breathing conditions should be more careful. And I honestly need to read up on the ionizing purifiers. I don't have a lot of information on that.
Okay. And the last question on this is, what is the ideal dose of calcium for a senior person?
So ideal dose is between 1200 to 1500 milligrams a day. And so the way to think about it is 3 cups of yogurt, like the full cups, not just half cup, but 3 cups of yogurt gives you about, so 500 milligrams of calcium is in 1 cup of yogurt or 1 cup of milk. If you're able to take 3 of those a day, that's wonderful. That should give you your calcium requirements. Otherwise, you may need to take a supplement.
So some people are vegan or, worried about the cholesterol and things like that. So do you recommend like full milk or less, like 2%, 1%?
Yeah, I recommend 1% or 2%. Make sure it's vitamin D infused. I don't think very few people really need the whole milk other than kids. Um, but definitely, if you're vegan, then you may have to take external supplements um, for calcium. But if you can take milk products, sometimes calcium can cause other problems like, constipation and things like that when people take it as a supplement. So if you can take it in your diet, that's excellent. But if you can't, then yes, I would suggest a supplement.
Okay, one more question popped up, which says, because of the pandemic, we are not able to walk outside. But do you have any ideas for this seniors group where they can get 1 or 2 miles walk at home?
Um, I would say just so ideally, I think most of us either have a smartphone or one of those step measuring devices. Um, if you can get up to 6,000 to 10,000 steps a day, that would be really great. But any amount you can walk on a treadmill, or you can walk in your garage, or even in your home, in your backyard. Just put on some music and walk in your backyard. That might be good. Um, but any walking, even if you're just walking in your home, if you can get the steps in, there's still a lot of value in that.
Okay. And the other one is related to the pain for seniors. So saying if they experience pain, then what might be the best way to manage them at home? So you partially answered like massage and Ayurveda
Yeah.
and
Yeah.
homeopathy, yoga.
Well, I would say, we need to figure out. So pain can be very tricky in the sense it could be coming from muscle, it could be coming from bone, it could be coming from, an organ system. So now as we get older, most of us have arthritis and some aches and pains that are pretty routine. So it really, you need to know your body well. I think you need to manage pain in consultation with your doctor, because there needs to be a proper diagnosis. If it's a uh, if it's just a arthritis, routine arthritis kind of pain, yes, you can try over the counter, Tylenol, or you can try, some people like heat, some people like cold. Um, you can try massage. But I would say, any new pain should definitely be consulted with the doctor first. Make sure you have the right diagnosis, and they can recommend. Be careful of taking over the counter aspirin and, ibuprofen kind of medications, because they can be a little hard on the stomach lining or on the kidneys. So always consult with your doctor, because I have seen too many seniors kind of taking ibuprofen and having ulcers and other problems. So those are medications I'm very, very cautious with, especially in my senior population.